Hi again, everybody. This is Jerry Serino from the Median Podcast. Thank you, as always, for listening today. Please go to fromthemedian.org and also follow us on all the different social media at Cleveland Right to Life. We are always looking for great guests, and as usual, I think I've delivered, bragging a little bit, but I am here with Dr. Renata Moon. She is a board certified pediatrician with expertise in both general pediatrics and pediatric hospital medicine. And she is an advocate for medical freedom. And she's here to educate us. We really need her expertise on this topic. Dr. Moon, thank you for being here.
Yeah, thank you for having me. Appreciate it.
Yeah, thank you so much. So let's get right into it. And you know, there's so much talk. I think it started, and you could tell me if you agree, started with COVID. There's
Yeah.
no doubt about it in my mind, of questioning what the experts in the government are telling us. Tell me about how you said to yourself, "I got to speak up." Like, what was the impetus? What were Take me through that path.
Yeah, so I was practicing as a pediatrician, as a pediatric hospital physician, and also as a professor of medicine at several medical schools, working more than full time as 2020 hit. And so I saw this
Mhm.
whole thing from a bunch of different vantage points, right? I saw it in terms of medical education. I saw what was happening to our nation's children, to their mental health, to their physical health. And oh boy, yeah, it
Mhm.
definitely there were a lot of problems, right? And I will start by apologizing to the American public. I say this often. I'm so sorry for what has happened to our healthcare system. I'm not
Mhm.
responsible for it, but this is using the word embarrassment would be an understatement. This is horrible.
Yeah.
What's happened to our healthcare system is horrible. We've all together lost trust in these higher up federal agencies.
Yeah.
Who do they think they are? Who do they think they are, lying to us and telling us the things that we all witnessed during COVID? So
Yeah.
we could be here for hours as I tell you the story of how this rolled out. But as soon as I began to see that this was in my lane, and my lane being medicine and our
Yeah.
children and medical education, I began to
Mhm.
speak out. Yeah.
Yeah. I want to go through the lies. So I watch, videos from people on the left. It's always people on the left, who will say, when a conservative commentator in a debate or a discussion will say, uh, you know, Fauci said that if you get the vaccine or the shot, you won't get COVID. You absolutely won't get it. You won't transmit it. Um, Tell us about that.
Well, who elected Dr. Fauci to
Yeah.
tell us what to do? This
Yeah.
this should, right from the start, have been a large group of our best and brightest physicians and scientists sitting down as a group and looking through the data that we had and saying this is what we recommend for the American people to consider. And
Mhm.
instead, it turned into a one-man dictatorship, didn't it? You know, again, I was looking at this from the lens of pediatrics. There was no emergency for our nation's kids. Our kids were
Right.
not dying in some, again, there were some pediatric fatalities. I'm not trying to minimize those, but we have sadly fatalities with kids every year from the flu and other viruses. But this was not some major emergency crisis. Your child had a 0.00027 or something even lower than that chance of dying from COVID. And so
Yeah.
this was fear mongering. This was improper use of the media, AKA propaganda. This was
Yeah.
being fed to us you know, in shovelfuls. And I'm the daughter. I was born here in the United States. I'm a naturally born American citizen. I love this country. I'm the daughter of parents who fled political persecution from behind the Iron Curtain of communism. At the age of 12 years, and again, when I was, I don't know, in my early 20s, I visited relatives behind the Iron Curtain. I have seen communism myself firsthand. I lived in it for a few months with my relatives. I know what it looks like. I know what it tastes like. I know what it smells like.
Yeah.
And everything I saw in 2020 was screaming, this is a communist system that we're descending into. Uh,
Yeah.
yeah. So
Yeah.
yeah.
So going to the Fauci lie, because it was right to say that the shots, whatever company you used, stopped you from getting COVID, stopped transmission from one person to the next. There was, and again, you please correct me or
Sure.
validate me. There was no data, no such study, no such anything that indicated that you can't transmit it from, if you once you get the shot. There was nothing that said that, correct?
Well, I don't like to use absolutes because you can get into a lot of trouble with absolutes. So I don't know,
Okay.
maybe they had a study somewhere that said something. But the
Right.
reality is, we were rolling this out into the population and we were going to see for ourselves, right? We were going to see, were we seeing cases of COVID in people who were vaccinated? And the answer was pretty clear pretty quickly, right? Yes, many of our colleagues, many of our friends who had multiple doses of safe and effective, right, in quotes, came down with COVID. So
Hmm.
this was something that was readily apparent to all of us. And pretty soon they were backpedaling, right? They were on TV. We had the CDC director, Dr. Walensky, up there saying, "Yeah, we can no longer stop transmission." It never did stop transmission from what
Yeah.
any of us saw, right? So we could see this with our own eyes, and yeah, the whole 6 foot rule. So when the first
Yeah.
recommendations rolled out, I actually didn't think they were that unreasonable for a few weeks to kind of keep
Hmm.
people apart, because it made sense to me. If you have a brand new infection like this virus was, it was a brand
Hmm.
new to our continent. If you have this brand new infection hitting a huge population of people all at once, then
Yeah.
even with a very low fatality rate, for example, for pediatric patients, which it had, you, and a higher fatality rate for adults, which we know existed, you're going to have a huge number of people that hit the emergency room really quickly because they're all going to be exposed to it pretty much at the same time, right? So to keep us from overwhelming the healthcare system, it made sense that we should separate for a while and not transmit it from one to another if we socially distance. So I bought that. I thought that was okay for a short period of time. But the
Hmm.
reality was we were all going to be exposed to this virus at some point. This was not
Yeah.
something you were going to escape unless you hid you know in some old rundown cabin in the recesses of
Right.
Alaska someplace. You weren't going to escape this. And so
Yeah.
so the idea that it was going to slow the spread and not overwhelm the healthcare system made sense to me until I set foot in my hospital. And you could literally hear a pin drop in there. We had no patients there. Like, this was not a hospital that was overwhelmed. This was a hospital that was empty,
Hmm.
with the exception of, I'm sure, some adults who were affected in the ICU.
Yeah.
Right? Yeah.
Yeah. And we know that that it specifically impacted elderly people with pre-existing conditions, people who were, physically, uh, you know, inferior. I don't. That's a bad word. I don't mean to say inferior, but they're sick. Our grandparents, were susceptible, right?
Yeah, unfortunately they were. They were also, elderly people were much
Hmm.
more at risk from this than
Hmm.
their children were. So I want to bring something to this conversation that will be new to the listener. I don't, I think we realized that there was a massive public health catastrophe here with COVID, right? But
Hmm.
let me give you a couple other facts that will put this into comparison. So,
Okay.
as a practicing hospital physician, I was full time working in hospital settings with kids, really sick kids from my region, from, well, really for a long time, from about 2005 through 2021. Okay.
Okay.
And so I remember the swine flu. You remember the year where we had swine flu? I think it was around
Yes.
2009. So to put this in perspective, the year that we had swine flu, that was the sickest I'd seen our nation's kids be, at least in my region. We went from maybe one child a week in the winter that had to have a chest tube placed. So that's a tube to drain fluid, infected fluid from the lungs, maybe one a week in a normal winter. And during the year of swine flu, we had probably 7 or 8 kids, maybe more, on the floor at any given time with a chest tube in place for a number of days to drain this infected fluid. So the kids were really sick from swine flu compared to
Mhm.
what happened with COVID. When you look at the fatalities from swine flu, and I looked that up, it was right around 1,200 fatalities in that one year alone from swine flu. Now, the numbers vary in terms of how many pediatric fatalities per year from COVID. But in the early years of COVID, there's somewhere between 350 and 480 per year that they allege,
Mhm.
children died from COVID. So let's give them those numbers. We had about 3 times the number of kids who died from swine flu in 2009. Did we close down our schools? No. Did we panic
Right.
everybody? No. Did we mention it on the media? Yeah, it was mentioned. It's a particularly rough flu season this year. Swine flu has not been good to our kids, but we didn't go crazy, right? And that was in 2009. Flash forward to 2020 and 2021, 2022, and the level of fear mongering that happened. Again, why in the world did we give a recommendation for this mRNA shot to be given to our nation's children when A, there was no emergency for them, and B,
Mhm.
we had no idea what the long-term safety studies were, and the short-term issues were alarming. So we should have had a discussion there for our kids, and we did not have that. And in fact, we saw that discussions were shut down. They were
Mhm.
completely shut down at the medical school
Yeah.
level,
Yeah.
nationwide, at the federal levels nationwide. We were threatened. I lost my position as a professor over this because I questioned why the COVID shots were being recommended for children at a 2022 US Senate hearing in Washington, D.C. And as a result of my testimony as a private citizen, not representing the school, I issued a press release that I was not representing my medical school. I lost my position as a professor at that medical school for having spoken. And so we censored physicians in a very heavy way. We did not allow that discussion to happen. And that's not healthy medicine. That's not healthy science. And that is a terrifying future if we let this continue. Yeah.
Yeah. No, I know. I followed it. I was little old me was censored. If I even asked a question about it online, I had
Yeah.
YouTube pages shut down over just asking. So another area that there was a lot of controversy, and again, I don't if you're I believe you could talk about this is hydroxychloroquine and ivermectin.
Yeah.
Can you give us your perspective on those?
Well, for pediatrics, I really didn't use those at all because they weren't needed. So kids were,
Hmm.
in general,
Yeah.
again, the majority of the kids, excuse me, the majority of the kids that I saw with COVID had the sniffles. They had a cough and
Yeah.
they had a cold. Okay. And I'm not,
Yeah.
again, I'm not downplaying it. There were some kids who were hospitalized with COVID, like you see with any virus, they get dehydrated. There were some kids that had other reasons for their admission, respiratory distress, and things like that. We see that every year with viruses. Um,
Yeah.
but when it comes to hydroxychloroquine uh, and ivermectin, look, these are medications that have been used very safely for decades. For decades. Now, I don't use them much in pediatrics. These are more
Mhm.
medications for arthritis and for other rheumatological conditions, for parasites, as we all know. But they've been safely used zillions of times. Let's just say
Yeah.
billions to keep it safe.
It is, yeah.
And all of a sudden, it was a, oh, we can't even try that. Really? Can't even try something that's been used. Why wouldn't you? If it doesn't work, it doesn't work. But why wouldn't you
Mhm.
try something in the face of an illness that people were being told to just wait until they couldn't breathe to come in? Oh, we don't have any treatment
Right,
for you.
right.
So very ridiculous behavior, and we tolerated it. And that's a question we have to ask ourselves: is why did we tolerate this tyrannical behavior?
Yeah, thank you for that. I never understood. Well, maybe I do, but I never truly understood why people who were so quick to say hydroxychloroquine, no good, and not only no good, it's bad. People were saying, "Don't, it's dangerous. You can't tell people about it. They'll go get it." And even though in the US it's by prescription only, right? So
Yeah,
you can't just go pick it up over the counter. If this is so concerning, COVID-19, so deadly, so dangerous, we shut the world down.
that's
Why
right.
wouldn't you at least try it? Why wouldn't you
Because
convene?
you couldn't authorize something under emergency use if you had another product that worked, right? So
Yeah,
we we know why. And
yeah,
I never ordered it, but I met plenty of, because I'm a pediatrician. Again, that was
Yeah.
not needed.
You don't use it. Yeah.
But I met plenty of physicians who take care of adult patients. I met some heroic doctors out of Mississippi. These folks, they're quiet. They're not really speaking out. I'm not going to name names because they are literal heroes, but I spoke with them. Thousands upon thousands of patients that they saw during the pandemic from the Mississippi Delta region with some of the highest levels of, unfortunately, obesity and other chronic conditions that contributed to the mortality with COVID, right? With SARS-CoV-2. And they used the protocols. They used ivermectin, they used hydroxychloroquine, and they were telling me about their fatality rates that they kept track of with their own patients. And they were very, very low. I think several of the physicians I spoke with actually had no fatalities at all. Yeah. And so these products, when they were used early, they worked. And that was something that was a problem for the powers that be.
Yeah. It's so frustrated me beyond belief. And I'm just a I'm not in medicine. I don't know this stuff like you do. I just looked at common sense and logic, and I did research, don't get me wrong. But so then the underlying question on all this, whether it was the lying, the way overreaction as far as how we reacted to COVID versus, as you mentioned, the swine flu, which, by the way, I don't know if pigs are offended by the use of the word swine flu. If there are any that are listening that are offended, sorry, I apologize for that racial comment.
We
calling
don't
it the swine flu.
Use of terms.
Yeah. So anyways, then we get into, the way, the forcing. I mean, I would go to the grocery store, Dr. Moon, and have arrows in the aisles telling me which direction to go to, or plastic barriers between me and the cashier as she touched every item that I had anyways. And I sometimes would be like, am I the only sane person in this world when I would go through this? But yeah, go ahead.
There were many of us that were saying this, but wasn't it crazy to watch this? So my quick story was San Diego car rental return. And I just dropped off my rental car. And it was a bright, beautiful, sunshiny day in San Diego. This was not in the airport. This was off site, right? Off the campus of the airport, so to speak. And I could hear the airport terminal man. And he was like, single file, masks on, single file. And I thought to myself, I'm going to have a problem with this dude. And I rolled up there and he's on me. Mask on, single file. I just looked at him. I pointed to the sun and I said, and the brisk ocean breezes were blowing. There was no COVID that was going to get me outside. It was ridiculous. I looked at him and I said, UV light kills it. No. And he yelled at me again. He said, I said, put your mask on. And I looked at him and I said, really clearly, I said no. And I had my leg ready to go. If he'd come near me, I was going to place it properly. And but the line of people, single file, masks on, in a row, in the sunshine, in the brisk ocean breezes, standing there to board that shuttle bus. I got at the end of that line. I did not have a mask on. He left me alone. We need to be, I'm not advocating for any, I shouldn't have said the part about the knee, but I did have my knee ready. But if
you were thinking about it,
come at me physically. I'm not advocating for physical violence. Okay?
Right.
Come at me like physically, I would have, it would have hurt. So, but I got in that line. I did not have my mask on, and he left me alone. He didn't have any right to do that. We need to understand that this is our health is our decision, and this was ridiculous. We saw ridiculous measures being put into place, all for the common good, with quotes around it. Where have we seen that before in history? Yeah. So ridiculous.
So then here's the underlying question on all of these lies and way overreaction and totalitarian. I mean, I could give you stories about being on an airplane and being yelled at by a stewardess about my mask as I'm trying to drink something and whatever. The question then becomes why? Why did they do this? Right? Why did they not do it for the swine flu, but this happened for COVID?
So I'm not an expert in this area. I can give you, obviously this is not healthcare related now, But
Hmm.
as someone whose family had fled from a communist system, I can guarantee you that we have all learned something in the last few years. We learned as a nation that these are negative things. We learned that it's okay to censor one another. We learned that it's okay to shut people down. We learned that it's okay to rat people out. Your neighbor's doing something, you didn't like it. They didn't
Hmm.
have their mask on. What did you do? You ran to the police equivalent, right, of all this, and you said something to get them in trouble. We learned really horrible things during this. We learned how to turn on one another rather than unite as a freedom loving group of people that all want the best outcomes for ourselves and for our children, right? We are
Hmm.
absolutely in the early stages of communism. We are already there. This is not, I hate the use of the word socialist because socialism is just one little pebble stone on the way to a full communist system. We are already in the early stages of a communist system. And, you know, who is orchestrating all of this? How does this all tie in? I will let other people take that part over. But I will say that I believe that we all have a tendency as a society to not just drift, but to drive straight into these kinds of systems. And we have to fight against that. President Ronald Reagan had that quote that I will misquote in some way, but he said freedom is just one generation away
Hmm.
from being lost. And did we not see that happening with all of this? So we are already in the early stages of communism. We can still move, we can still speak, we can still do things to some extent, right? We're heavily censored even today, but we can do those things. But eventually, if this system hardens around us, and my analogy is that of a swimming pool. If you've poured a bunch of liquid, whatever it is, concrete into a swimming pool, it's real thick, but you can still move in it, right?
Hmm.
Eventually, it's going to harden around you, and we're all trapped once that happens. That's what has happened with other civilizations. That's what happened to my relatives in Czechoslovakia. That's what happened in China. That's what happened in North Korea. We could tick our way through all of these, Stalin era, Soviet Union. This happened in all of these places. We are not immune to this. Right now,
Hmm.
we can still move to some extent. We've got to be loud, we've got to be strong, and we have to realize that we are not alone. More and more people have woken up to this. We cannot let this happen again, and we cannot let it continue to happen because it continues to tighten down around us.
Yeah, and that's the importance of maintaining our freedoms, and regardless, right? That we have to keep that freedom of speech. All our great amendments are there for a reason. So I noticed that on your underneath your name here on the video, you have silentmajorityfoundation.org,
Yes.
so that people can know about it and go there to support. Tell us, if with about a minute left,
Okay.
about this foundation.
This is the legal team, and they're fighting for all of
Yeah.
us. We're fighting for us all. I launched a lawsuit against my medical school employer for all the things that happened around COVID. Again, I lost my position as a professor by non-renewal of my annual faculty contract after an investigation for the shocking, shocking act of speaking as a private citizen to my own U.S. Senate at a Senate
Mm.
hearing. A week
Yeah.
and a half after I lost that position, I was reported. So I was no longer their employee, but a week and a half later, they reported my testimony at that Senate hearing to the medical board of Washington State, asking that my license be investigated, which it then was. This is outrageous. Every
Yeah.
American, so I'm fighting for all of us. That's why I'm doing this. So Silent Majority Foundation is helping with all of this. They are the legal team. They are strong, they are ferocious, but they need your support. And again, we're doing this for everyone. Look at my name, silentmajorityfoundation.org. You can read the documents, read them yourselves, and take a look at
Mhm.
what this looks like. Look at history playing out here, right here in America. This is history
Absolutely.
repeating itself. Yeah.
Yeah, absolutely. Thank you so much for all that you're doing, because it is important, and you're absolutely everything you said, absolutely fantastic. Everyone, please go to silentmajorityfoundation.org and support. Dr. Renata Moon, thank you so much for joining me. I really enjoyed talking with you.
One last little thing to say, which is that every
Yes.
person listening is important. You are just as important as I am. My MD does not give me any more importance than what you can do from your own living room. You are just as important. Okay. We are all in this together. Link arms and let's go. This has to stop.
Absolutely. Thank you so much, Dr. Moon. And thank all of you for listening to this episode of From the Median Podcast. We will see you next time.